And if you need to lose that 10, 25, 50, 75, 100 pounds or more, contact your Youngevity associate and ask for the book Hell's Kitchen and the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, and learn how to lose a half a pound to 2 pounds a day, a half a pound to 2 pounds a day. That's because, again, the medical doctors have it all wrong. Being overweight and obese has nothing to do with lack of exercise, eating too much. It's actually a simple deficiency of the nutrients. Get a hold of the book Epigenetics and the book, Hell's Kitchen, and learn how to lose a half a pound to 2 pounds a day. And you'll never gain the weight back as long as you stay on your 90 for Life program. Okay, Doug, what pearls of wisdom do you have for us today?
I wanted to talk a little bit about weight loss, as I've got a story here from Reuters that his headline, number of obese and overweight children are under 5 alarming, according to the World Health Organization. They said at least 41 million children under the age of 5 are obese or overweight across the world, and say the number of obese and overweight children has risen by 10 million since 1990. There are now more overweight and obese children in low and middle-income countries than there are in high-income countries. In developing countries, the number of overweight children more than doubled to 15.5 million in 2014 from 7.5 million in 1990, driven by globalization and urbanization, according to the World Health Organization's Commission on Ending Childhood Obesity, better known as ECHO. Their co-chair, Saria Nishtar, said overweight and obesity impact a child's quality of life as they face a wide range of barriers, including physical, psychological, and health consequences. So almost half of the overweight and obese children under 5 live in Asia. 25% live in Africa, where the number of overweight children has almost doubled to 10.3 million in 2014 from 5.4 million in 1990. Libya, Egypt, Morocco, Algeria, Tunisia, and Botswana are the highest percentage of overweight children among the African countries. They say children who don't have access to enough nutritious food in early childhood are at a particular high risk for becoming obese, and when their food intake and activity levels change. Say children of migrant and indigenous people were also at a higher risk of becoming obese due to rapid cultural changes and limited access to health care. Now, I don't understand how limited access to health care is going to affect your amount of obesity and being overweight when we have a third of the people in this country, we're leading the world in being overweight, and we have the most access to health care of any country on the planet. So that doesn't make any sense.
Well, it doesn't make any sense if you're looking for truth, but if you're looking for increasing your income from people and you're a medical doctor, you say, well, anything that's going on with health, we see more doctors, the problem will go away, right? So that's just a sales campaign. They're taking advantage of a situation here. Now, the first time I went to China was back, it had to be 1980, 85, 86, and everybody there was skinny. I mean, everybody was skinny. There's almost no diabetes. Now you go to China, 50% of the people in China are overweight and obese, and diabetes is breaking them financially, okay, because they pay for everybody's health care. Well, basically the problem comes like this, and same thing with Africa. When I was in Africa back in the 60s, everybody there was skinny. Now there's so much obesity, it blows your mind. So what's going on here? Well, Doug, what happens is, as soon as a country gets into the leading edges of being a first world country, an industrialized nation, they give up wood stoves, no more wood ashes for the gardens, and they go to electricity. So they don't have access to their source of minerals, and so their appetites go up because they're minerally deficient, and they all gain weight. I mean, within 10 years, after moving to electricity from wood stoves, no more wood ashes in the garden, more electricity, guess what? They all become overweight because they're minerally deficient. And so what we've got to do is get the word out, get on the 90 for Life program, the healthy blood sugar pack, 1 per 100 pounds of body weight. If you're on medication, take your fasting blood sugar every morning before you medicate yourself, and as your blood sugar drops, you take less medication. You're without medication for 2 weeks, and your blood sugar remains below 100 in American terms, below 5 in the Canadian terms. Guess what? You don't need the medication anymore, but you still need to stay on the 90 essential nutrients because there's not going to be these nutrients left in your food a week from now, a month from now, a year from now, 5 years from now. Still have to supplement. But it all is because of lack of nutrition. Get a hold of the book Epigenetics and Dead Doctors Don't Lie and lose the weight.